The anatomy of the jejunum and the ileum. The jejunum and ileum together measure about 20 feet. That is about 6 meters. The jejunum makes up the upper 2/5 and the ileum the lower 3/5. The jejunum begins at the duodenal jejunal flexure and the ileum ends at the ileocecal junction. The coils of jejunum and ileum are freely mobile in the abdominal cavity. They are attached to the posterior abdominal wall by a fold of peritoneum which we call the mesentery of the small intestine. The branches of the superior mesenteric artery and vein, the lymph vessels and nerves enter into the space between the two layers of the peritoneum, forming the mesentery. The differences between jejunum and ileum are: the jejunum is located in the upper left part of the abdomen, and the ileum occupies most of the lower part of the abdomen and the pelvis. The jejunum consists of a thick wall, but the ileum has a thin wall. The plicae circulares, which are thick folds of mucosa, are larger and they are closely set in a jejunum, but in the ileum it is smaller, it's far apart, and it's absent in the lower part. The mecentric artery forms 1 to 2 arcades with few long vasa recta in the jejunum, while in the ileum it forms 3 or 4 or even more arcades with short vasa recta. Peyer's patches are present only in the ileum. The superior mesenteric artery is the main blood supply of the major portion of the small intestine, right from halfway down the second part of the duodenum right up to the distal third of the transverse colon. The venous drainage is into the superior mesenteric vein. The lymph nodes drain into superior mesenteric nodes. The nerve supply, sympathetic and parasympathetic nerves derived from the superior mesenteric plexus, supply the jejunum and the ileum. The ileocecal valve is a rudimentary structure which consists of 2 horizontal folds of mucous membrane at the opening of the ileum into the cecum. It's not a true valve because it doesn't prevent any reflux. The circular muscle of the lower end of the ileum serves like a sphincter and it controls the flow of contents from the ileum into the colon. The smooth muscle tone is increased when the cecum is distended, but when the stomach is distended, gastrin is released and this causes relaxation of the muscle tone. Meccal's diverticulum. This is a congenital anomaly which represents a persistent portion of the vitellointestinal duct. On the antimesenteric border, that is on the opposite side to where the mesentery is attached, you would find this 2 feet from the ileocecal junction. It is about 2 inches long and it's present in 2% of people. The importance of the Meccal's diverticulum is it can contain a bit of gastric mucosa which can bleed, presenting just like an appendicitis when actually it would be a gastric ulcer that's causing pain and bleed. Should there be a fibrous band connecting the diverticulum to the umbilicus, a small loop of bowel can get trapped around it, causing intestinal obstruction.